When you visit a grocery store like Shoppers in Wheaton, Maryland, you might think of the food and the pharmacy as two separate things. But diet and medication are crucial parts of patient health.
If you know how a medicine works, you know all the side effects, when they should take it, and if you can explain that to the patient in a proper way, it helps their compliance, it helps their health.
There's a strong link between diet and diabetes because diet is really one of the cornerstones of managing diabetes. You know, we talk to patients all the time about what it's going to take to stay healthy when you have diabetes. And no matter what stage of development they are in the disease, whether they're newly diagnosed or have had it for years or they're type 1 or type 2, we're really looking to see that we're helping them understand the role of food.
That's why at Shoppers, pharmacists and dietitians work together on the healthcare team.
At Shoppers, we have this program called Eating Healthy with Diabetes, and it's a tools class. But it first starts off with me and a dietitian, a registered dietitian, going throughout the whole grocery store on a tour for diabetics. We tell them what foods have a certain number of carbs, we tell them how to prepare foods, we tell them how to read food labels. So we work in a collaborative fashion together to improve patient outcomes.
When a patient with diabetes comes into the grocery store, we can really help them understand where in the market everything is laid out. So knowing where their foods are to access and easily retrieve what it is they're looking for, to read food labels, to understand the role of carbohydrates and how to find the appropriate foods that they're looking for is invaluable.
After that tour, I actually host a class for about 2 hours or so where I talk to the patients all about their medicine. And then I have one-on-one follow-ups, 4 appointments per patient. And we talk about their medicine, I talk to their doctors, optimize their regimen, I talk about their diet, and then we have follow-up appointments to make sure their A1C is declining.
Teamwork and collaboration are vital parts of treating chronic conditions like diabetes.
When I'm working with a dietitian, it's an excellent opportunity to bounce ideas off of each other. My specialty is the medicine. Their specialty is the diet. Together with diabetic patients, we can get people on the right regimen so they're having the right number of carbs, the right number of units of insulin or metformin or pioglitazone, whatever it takes to get this patient in control of their disease.
So dietitians and pharmacists can work together as a team in a collaborative approach to diabetes management, because if we think about it, really those are the two major things. The medications and the food are the basis of all the management. So those two professionals are really the go-to people for people with diabetes, because we're going to have information about all the food questions that they have and questions about the medication.
And that makes patients healthier.
When a patient is eating correctly and has their medicine under control, their blood sugar values are lower. They're more in control, so they don't have the complications later in life, like the nerve pain, the kidney damage, heart attack, stroke risk, all reduced.
So because we're offering this service in a grocery store, patients have access to the food information, the medication information, and any other questions that they might have regarding their management all in one place. And what's really great about doing this in a supermarket is that they can really put hands-on with both the medications and the food.
But although pharmacists and dietitians work together, right now only the dietitian is recognized as a healthcare provider under the law. So let's recognize pharmacists as healthcare providers.
Pharmacists deserve provider status because we're all the same team. It's between the doctor, myself, dietitians, everyone, we're on the same team. What do we want? We want patient outcomes. We want reduction in heart attack and stroke. We want lower A1Cs. We want lower blood sugar values. We want better compliance. We're all on the same team. The pharmacist is a great opportunity to guarantee that the patient is taking their medicine as prescribed. We are able to look in the fill logs and make sure the patient is taking their medicine every day as prescribed to reduce their risk of disease.